back with the Baker Bear, so we don't have an actual person here. That's what we're using. So today we're going to be going over a couple shoulder instability tests. So we're going to start off here with Faegan's test. You would have your patient sit with their arm off the table, so you can kneel as a doctor next to them. You would have them A-B duck their arm, right? So straight out. We would then have put our hand, the head of humerus here, shoulder joint. We would reinforce and we would perform a downward pressure here. You're looking for a clunk or extra movement within this range here. You would be looking for pain. They're going to have localized pain here in the anterior top of the shoulder. You have all these rotator cuff muscles and ligaments. They're trying to keep this stable. As an overhead athlete, you're excessively putting pressure on these muscles and ligaments. So within this, if it's not stable, the ligaments are lax, you're going to have pain or excess movement here. Typically, again, you're going to have overhead athletes, or maybe somebody who fell on an outstretched arm, may have an AC sprain, things of those sorts. Range of motion wise, they may be limited in active range of motion just because of a muscular injury here. You're not really going to need any other imaging unless you're, for whatever reason, if you're trying to look at a ligament of those sorts, you may need an MRI. So second, we're going to do a sulcus test, is also an instability test of the shoulder. You would have your patient sit, same placement, you'd have them give you a 90-90 here, right? As such, you would then perform downward pressure here at the elbow joint. You would push down, right? So they would be here, you would be hanging on underneath here, pulling downward. Again, you're looking for a groove or a sulcus, hence sulcus test here. And then you're going to grade that. You have a grading system, 1 to 3. You'd be grading that depending on the amount of translation that you're getting here. This is testing similar structures. Everything is the same for the most part. Your 1 to 3 grading tests, though, grade 1 is going to be less than a centimeter of movement. Grade 2 is 1 to 2 centimeters. And grade 3 is greater than 2 centimeters. Again, you're not going to need extra imaging for the most part. These are to rule in or out instability within the shoulder. If you suspect ligament injury and for whatever reason you need to go in and have a further look, an MRI may be useful. Again, range of motion, typically active just because of the musculature in that area is not going to allow you either that full range of motion or the range of motion is going to be painful. So this is 2 instability shoulder tests, Faegan's test and Sulcus test.